Welcome back to another episode of Dentistry's Growing with Grace podcast. Join Grace and her guest of the week as they discuss lessons learned in the industry and explore unique insights into ethical growth.
Hello and welcome back to Dentistry's Growing with Grace. I am so excited. I have one of my favorite doctors here with me today, Dr. Brad Boeke. Dr. Boeke, thanks for joining me today.
Oh, it's my pleasure, Grace.
I have to tell the audience right now, my team loves working with Dr. Boeke. He's one of our favorites, always has a smile on his face. And not only that, always brings a smile to our faces. And I don't know where that joy comes from with you, but we so appreciate it. Dr. Boeke, to me, you are one of the most successful doctors that I've worked with. And that's based on how I define success. But I would love for you to tell our audience a little bit about you and how you define success.
Okay. I think when I first became a dentist, success was measured by what you took home, right? Economically. And that's still a good way to measure success. It's a way, I call it a way to kind of keep score. If you love playing basketball and you go play basketball, but nobody keeps score, nobody wants to watch, right? Because how do you know you're winning? So to me right now at this stage of my life, success isn't measured economically. It's, if I had to find one parameter, it's that I still find joy going into work with a team on Monday morning. It's kind of my raison d'etre. It's what I like. Like I said, I'm 65, I'll be 66 in a few months. I'm not bored. I love to interact with the team themselves. I love interacting with patients. My team calls it the Dr. Boeke Show because I'm trying to make an experience that is normally not all that appreciated into something that's a little more fun. We want, our saying is we turn dentistry into a want to, not a have to. And I just get a rush from that. I mean, we have like 700 Google reviews and all they talk about is, oh, when we come in, we can feel the atmosphere and Dr. Boeke's always so happy and his team is so good and they seem happy. And I guess maybe I'm a happiness junkie. I just like it. I mean, to me, that's success. Living your life the way that you choose to live it, not the way you have to live it. So that's always kind of been my thing. If I find myself getting bored, I do other things to, jazz it up. I placed my first implant in 1985. I expected a bunch of dentists with, pitchforks and fire outside my office, because that was heresy. We were trying to decide which specialty could put in implants. It certainly wasn't general dentistry, so that was kind of fun. And then I did some lecturing on the business of dentistry. That was fun. I was in the top 1% of one doctor, two hygiene practice, and that was fun, but it got boring. So I thought I'd blow that up and buy a 5,000 square foot building with 10 ops and 4 associate doctors, and then do another one in another suburb. And it's really all because I just like having fun doing it. And what a great gig.
That's awesome. I love business too. Even when I'm in a challenging situation, I'm learning how to overcome it. It's like, I know in the back of my head that's going to make me stronger, and that's part of the learning. And if you don't enjoy those obstacles, those moments of growth, then you end up being bored, being run down, and kind of not being able to bring that energy to lead your team. When it comes to leadership, I'd imagine when you have this mindset of positivity and very much leading with joy and happiness, how do you deal with people who come in with that ho-hum complainer vibe? Like how do you deal with that when you encounter that in someone on your team, or just in a day-to-day situation?
It used to be, quite frankly, it used to be that I tried to coach it out of them. You know, we did a lot of coaching, and sometimes it worked and sometimes it didn't. Case in point, Teresa that works for me, she's worked for me for 14 years. She's been through all the coaching with me. And I would have told you 10 plus years ago, she would have been the first one to fall off. Okay. So we had that, we started out with that old saying, hey, are you on the bus with me or not? And I thought she'd be the first one to get off the bus. And here she is 14 years later. I guess I hate to say this, but if we find that, you know, when they first join the practice, they're not really sure what to think. Like, okay, he seems so nice and everything. When does the other shoe drop? When does the jackass in him come out, right? And so I assume that in the beginning, but if they don't, at this point in my career, I don't have a lot of tolerance for drama. I don't have a lot of tolerance for people that don't fit my culture. We were doing some EOS coaching, entrepreneurial operating system. And one of the things I learned from that coach was, hey, I don't care how good they're doing, right? If they don't fit your culture, they're doing more damage than good. And I just took it on faith that was correct. And we had a major reshuffling maybe, right after COVID. We were getting ready to bring people back. And we did some core value scoring on them. And I had a great treatment coordinator, had to let her go because she was just all into gossip and stuff. And that just didn't fit the core value. So I guess I would say with team members, on a new hire, we try and coach them up. If on patients, if I look at the schedule and I see a patient and it makes me, kind of clench my teeth, I have a tendency to put wheels on them. I just simply send a letter very politely saying, you know what, I just don't think we're the best dental office for you. And sometimes it works out really well. And, I'll send it to people and they'll come back and they'll ask, hey, can I stay? I still remember I had somebody at the front desk. There was a guy, he was being a jackass about something. I can't remember what. And so I guess we were refunding part of his money. And the person refunding she said, well, where would you like us to send your records? Because we just figured he didn't want to be there, right? He's acting like he has no trust or whatever. And he goes, oh, well, I still want to have my dentistry done here. And she looks at him and she goes, yes, sir, everybody does. And then, yeah. So, I mean, it's like, sure. It's that old, we are ladies and gentlemen serving ladies and gentlemen. And so if don't act right, I don't need to keep you. I mean, one of the other sayings, some will, some won't. So what? Someone's waiting. So if you hold on to one of these people that just make your life miserable, the universe says, okay, well, that's your placeholder right there. You get rid of them and you got an open spot and they put a nice person right there. But if you hold on to them and it causes you more stress than you want, and not because of the procedure, but because of the person, I just simply tell them there's probably a better place for them.
Definitely. Yeah. And then you mentioned EOS. My favorite business book is Traction. I've read it 8 times.
Yes.
It's kind of my little business Bible I go back to. And on the back of my mind always is this person, do they get it? Do they want it? Are they
Yes.
capable of it?
Yes.
And if they don't want it, they're out. You got to want it, and you've got to be
Yeah.
able to communicate that you want it. And you got to show up Monday morning with a smile, just like me. And it's hard. I think it's hard to find, especially right now. We're kind of in this space where people a couple years back got this break, and they kind of feel like, well, why do I really need to work? And there's this whole movement of like side gigs and hustles. And I think we're finally getting to a point now where people realize that they need a steady income and they need a full-time salary. And the people that have been working the last couple of years, those are the people that we want. Like, I don't want to go and hire someone who's really just been chilling for the last 2 years. Like,
Right.
I don't want that.
Right. They're rusty at this point. And one of the other things that we do is we try not to throw the baby out with the bathwater. So sometimes you'll have somebody that you think is really a valuable employee or team member, but they're just not in the right seat. So, I mean, we've had a lot of people that we would take from one seat and try them in the other seat, and they would flourish. They were just, they were in the wrong seat. So
I do that all the time. I will hire a person for their core values and then try to find the perfect seat for them. And so sometimes when I hire people, I'm like, how flexible are you? What are you interested in? How flexible are you? Because your personality or your strengths aren't a perfect fit here. You could maybe also be a perfect fit here. So let's kind of see how this works out. I found people love that. They would rather have the position fit to them than them to a position. But I don't know.
we have a young lady in Mesquite that sent me a text. Dr. Boeke, I reapplied for my old job. I realize now that, I'd made some mistakes. I want to stay. I want to come back. I want to retire working for Bayside Dental, so forth and so on. And so we examined her last employment record, and we found out that there was an office manager that perhaps sabotaged her a little bit, that she is more of a people person. And if you stick her in an office by herself, she's going to find something to distract her if it's not dealing with the public. So we hired her back. She's tickled to death. She's working 6 days a week now.
Wow.
2 of them, I think, here in Rowlett, and the other 4 in my Mesquite practice. And she is thriving. She's thriving. So I don't know whether it's because she got to come back and now she knows the value of where she's at, or she was just in the wrong situation at the wrong time. So, I like I said, I try not to throw the baby out with the bathwater. I eat a lot less crow than I used to when I knew everything. I knew everything probably when I was a junior in dental school, and then I kind of got dumb for a number of years. And then, I started to trust myself more in the leadership position. And so I always look at what's my part in this, right? In other words, is it the person, or was it my lack of leadership? We're having a meeting today because my hygienists were starting to butt heads on treatment, on different treatment protocols. And I realized, oh my gosh, I lost 3 hygienists. I never got these hygienists together to say, hey, what can you all agree on that I can agree on too as treatment protocol? Well, it was my fault as a leader. I'd lost 75% of my hygiene team, and I never thought to bring them back to redo the meeting that got everybody on the same page before. So
now you sound like Extreme Ownership, which is another one of my favorite business books. I don't know if you've read that book or not.
Have not.
It's by some ex-military, and the whole concept is that you're responsible for everything in the business as the owner. And so just that mindset has always stuck with me. And I took it a little too far to the point where
That's okay.
I was taking responsibility for the people that weren't showing up. And I was like, everything was on me. And then I realized, actually, I had a coach help me realize. I had one of those aha moments where I was like, oh, wait, no, I need to hold people accountable for their part too. Like, you've got to
Correct.
be able to let go of some things here. But that's a great concept still to have as the leader, that you are responsible, because ultimately you're responsible if you keep that person that maybe isn't a cultural fit and you've given them an opportunity to be and they're not. That's still your responsibility to resolve that. But I just think it's amazing what you've accomplished, the practices that you have, the personality and demeanor and happiness that you spread to your team, to your patients, and even to what some people will get on the phone and just call us a vendor. And you and your team, anyone we've worked with, has never treated us like that. And it's just been just great knowing you. So
Thank you.
yeah, and I know that you do some interesting work, and you've got some interesting new fun projects. You might be a little bit bored right now, so you're putting new challenges on your plate. Tell me a little bit about this expert witness thing that you do.
Sure. So as I alluded to earlier, I did like 4 or 5 years of speaking. Actually, Bayside came about because of that, because I'd get back from New York City having done a speech, and I was the only doctor, and I'd come in Monday, and Reagan, who's worked for me for 10 years, one day I walked by and I heard her go, yeah, he's going to be a bitch today. And I thought, I'm what? And she goes, yeah, you, Dr. Boeke, you go out of town, you do this speaking thing, you come back Monday, it's like you take it out on us because you're tired. And I thought to myself, is that true? I do the Byron Katie thing. Is that true? How can I know that it's true? That kind of, so I do the work on it sometimes. And she was right. I do. So I thought, well, what do I do? Oh, I know. I'll hire some associates. Well, practice isn't big enough for associates. So what do I do? Oh, go build a bigger practice. So I did that. And then I never really found anything I wanted to lecture about. Nothing interested me. I was truly tired of pushing other people's agendas. And so I hired our friend, Catherine Itel Belt, to work with me for a day on coaching me on speaking and so forth. And she said, Brad, one of the things that's interesting is you have this expert witness gig. And I said, yeah. And she said, have you ever seen a lecture on being an expert witness? And I said, no, I really haven't. And we Googled and it wasn't there. And so we figured, since between the two of us, we had 75 years of dental experience, that might be a niche. So we started talking about it in that way. And I realized it tripped my trigger. I like the idea of doing this. Back in don't get me lying, 94, 95, I had a friend that I had worked with in the past, Dr. Vernon Kruger. Dr. Kruger's a dentist / lawyer, overachiever. And the funny thing is, he's my size. We're both 6'6", great big guys. We both have ranches about 15 minutes from each other. And so anyway, he calls me and he goes, hey, I'd like to hire you as an expert witness. I didn't know what that was. People still, when I say it, they go, oh, like in car wrecks and stuff? No, in dentistry. They sue dentists? Why, yes, they do, Karen. So, so it was a federal case. So, I started out at 100 miles an hour. And this guy shows up at my front door with a 2-wheeler and maybe 5 of those big legal boxes stacked with depositions and records. And I was working with an epidemiologist up in Colorado, and it was huge. And so Vernon apparently liked the way I did it. So he continued to hire me. And then a couple other attorneys here in town, he recommended me to them. Then in one case, I was testifying for the patient, and they liked me so much, they hired me, and I've been working with them ever since in the defense of the dentist. It's fascinating. it's just fascinating work. I like to tell the story about when I graduated from dental school. I loved college. Oh God, I didn't want to go out in the real world. So I said to my dad, who's a dentist, I said, hey, Dad, this is great. Got my dental degree. I said, I bet I'd be really good in the legal field. And, especially now that I have my dental degree and, I'm knowledgeable and so forth. He goes, I think you would too, Bradley. He said, now who's going to pay for it? And I said, Dad, I love being a dentist. So I went out to be a dentist. So it's kind of funny that I fell into this role, but I think the timing is right, Grace. Here's part of my deal. I think the timing is right. There are a lot of dentists that retire and maybe they get bored, but they don't want to go back to patient care. They'd make great expert witnesses. A couple of Catherine said this to me, and one of my associates confirmed that there's this whole generation of dentists. They've been out maybe 6, 7, 8 years, and they're not really thrilled with chairside work. Dr. Batanzas told me one of her friends became a biology teacher. So they have this knowledge and they can use it in a different way and still be very successful at it. So I think there's this group that would really want to hear about it. And then there are those that are fascinated. Catherine and I were saying, in the world of dentistry, there ain't much sexy, right? But back in the 90s and early 2000s, forensic dentistry got to be sexy. I mean, you'd try and register for a course at a convention. That thing was full. Now, did we think we were all going to go out and be, forensic dentists? No, but it was at least something sexy in dentistry we could, listen to. And I think the law in dentistry, it could be a sexy subject. I don't know. I just know that nobody's doing it. I've got a lecture I'm done with. I've got a 2-day workshop that I'm going to work on with Dr. Kruger, where in the morning or in the first day we lecture and we talk about things. We take them to my ranch, which is closer to the university where we're going to deliver it. And we're going to have a little barbecue out there, a little Texas barbecue. And then we're going to hand out depositions, records, and so forth with the names blotted out, right? Or we'll call them Mr. Smith, Mrs. Jones, whatever. And the next day, we're having a witness box built, and Dr. Kruger is going to go ahead and take their testimony for about 20 or 30 minutes, try and trip them up, do different lawyer attitudes on them. And he'll do that for about 20, 30 minutes. And then as a class, we'll talk about what worked, what didn't work. And I'll talk about maybe how I would have answered something or how I would maybe have changed things around a little bit. And I think it's a great idea. It kind of gives you, the knowledge, but it also puts you through it. So you kind of have an idea. And one of the things that I'm also writing a book. I'm about 3 chapters short of getting done. But I think one of the first things that I say in the book is you have to be willing to go to court. Now, are you going to go to court that much? No, you're not. You're going to write a lot. You're going to read a lot of stuff. You're going to talk to the attorneys a lot, and you're going to write an expert witness. Are you going to go to court? No. But if you can't, please don't sign up to be an expert witness. They can't change ships in the middle of the stream like that. And if you're sitting there shaking because you're so nervous, I can't tell you the number of dentists who, especially like female dentists, because they have long hair. How many times Vernon would look at me and go, "Hey, Brad, can you go get our client?" "Sure, I know where she's at." "Well, she's in the ladies' room throwing up." So I go in there and,
Oh my goodness.
No, I go in there, hold her hair up, and we get it all done with, and then kind of get her back, cool down, and then we go back into the courtroom. But it's stressful if you're not used to it. This ain't Perry Mason on TV. Well, nobody knows Perry Mason anymore. This ain't law on TV. This is
right.
nice and clean. It can get nasty.
I mean, here's the thing. You're not going to know if this is something that you would really enjoy until you learn
Correct.
about it.
Correct.
The workshop sounds like a good time. It sounds like fun. It sounds like something new that you can learn. And I would argue that even if you're not totally sold on the idea of becoming an expert witness, as a dentist, as a practicing dentist, don't you want to get a little bit familiar with what kind of cases do arise? I think it educates you to protect yourself a little bit as well.
Absolutely. And we'll go through things. One of the ways Dr. Kruger and I got to know each other better was he had a course down in Austin about record keeping and good record keeping and how to, stay out of trouble. So, we'll talk about that too. We'll talk about some of the things that are missing from some of these records that we give them that there's no defense for. I have another attorney friend, Ty Bailey, gave me some input, and he said, when it's obvious, don't argue. You just look like an idiot. Dr. Boeke, where are the vital signs on this appointment? They're not in the record. Don't be a jackass and sit there and try and argue that they're somewhere they're not, or what might have happened, because you don't know.
But really, everyone needs that information.
Yes.
Even if you're not in court,
Correct.
If somebody asks you a direct question, just give them a direct answer.
Oh, listen, Grace. So Ty tells me he has this nurse practitioner as his witness, and so he calls. He takes a little time out there, and he goes, "Look, you're arguing everything. Don't argue everything. It just makes you look bad." And she goes, "Okay." He said, "I'll be darned." She went in there and started to agree with everything the plaintiff's attorney was trying to throw her away. He had to call another one. He goes, "No, you don't have to agree with everything either. Just don't argue with the obvious." So besides my years of doing it as a dentist, I reached out to friends of mine and I said, "Hey, if you're going to hire an expert witness, what would you like them to know? What can I do to make them better and make your job easier?" So I got feedback from them, and I got down about 19 really good bullet points that I'm going to work on, push home. I'm going to have a, what's it called? An epilogue. Anyway, at the end of the book, I'm just going to tell some great stories about, some of the cases I've had. It's very entertaining sometimes. I will tell you this. If I get a deposition and they go, "Dr. Jones, is this the first deposition, or have you ever given a deposition before?" And they go, "No," I just sit back and go, "Oh, let me see the fireworks," because it's going to be insane. It's going to be insane. But I think, dentists like to have, like to learn about other procedures that, can improve their skills, make them more income. This is one where I can improve your skill and I can make you a lot more income. I mean, I only charge $500 an hour, and I find out sometimes they'll ask the witness, "Well, what do you charge?" "Well, I charge this." And so one time the judge didn't appreciate it when they said, "Well, Dr. Boeke, how much do you charge?" And I said, $500 an hour until I heard the last witness, Judge. Now I'm going up to 7. So yeah, it was, yeah. So anyway, and that's for just sitting there and reading records. So you can sit there and watch college football, and when the commercial comes on, read for a few minutes, make $100 and then go back to watching the game. I mean, it's a great gig. It really is, and it's fun. It can be fun. It can be stressful though. It can.
Yeah, well, at a certain point, for different reasons, whether your body starts having a hard time doing clinical dentistry, or you just need a change of pace, or maybe you don't want to be clinical full time, maybe that's just not your thing. Or, there's so many situations of so many people I talk to that could really enjoy this. So I think it's a fun opportunity for people to learn about. So how would our audience get in touch with you, or how would they learn more?
Well, I have this amazing marketing company setting up a website for me called drbradboeke.com. And that is where you will learn how to sign up, possible dates. We're going to, by necessity, obviously limit our workshop because we want everybody that's, when you go to the workshop, I think you're a little more serious about doing this. The lecture, I simply hope to inform, to give you a taste of maybe what it's like. Tell some good stories. My friend Garrett Gunderson calls me the storytelling dentist. I don't know, it just falls out of my mouth. I don't do it on purpose. It just happens. And so I think that's the way to get started, or if you already know that you want to be, we're going to, set up this 2-day workshop. We just think Vernon and I are about the same age and we're kind of slowing it down, and we just think it'd be a lot of fun. And like I said, one of his ranches is only 15-20 minutes from mine. And so we're going to do it in Commerce, Texas, which is very close to our ranches. I've already lined up good room rates. I do a lot with Texas A&M Commerce, which is the university there. They are setting us up in this beautiful room with this big outdoor balcony that faces this lake, when you take breaks and to serve us lunch and so forth. So I'm getting I guess I'm getting the physical parts down now, but when drbradboeke.com comes up, that's where you'll find out about the expert witness stuff.
That's awesome. Well, I'm excited for you. I'm excited to see how this goes. I find it very interesting, and I know that that some people in our audience will as well. So they will definitely look you up and buy your book and go to your events and just see where it takes them. So thank you so much for being here.
Thank you, Grace. Today. I appreciate it. Thank you.
My pleasure. And thank you to all of you out there who follow, who are maybe in our Facebook group or listen to our podcast, Dentistry is Growing with Grace. As always, if you ever need any help with growing your practice, please think of us, identitydental.com, and have a great day.